A very good afternoon and welcome to the session on a very important topic, which is irregular periods. We are glad to have Dr. Maitri Sharan with us today to help us understand the topic in detail. If you have any doubts, any queries related to the topic, you can drop on the comment section. The doctor will take all your questions by the last of the session. So stay tuned and also be with us. And if you miss by any chance, you can find it on Facebook and YouTube on Apollo page. You can drop your comments then also. Our doctor will help you by answering there. Doctor, you have the stage.
Hi everyone, good afternoon. I'm Dr. Maitri Sharan, gynecologist consultant at Apollo Cradle Jubilee Hills. Today we are going to talk, because of the technical issues, we cannot share the PowerPoint. So let me explain what is irregular cycles. So coming to the irregular cycles, we have to know what is normal periods. Okay, when we know the normal cycle only, we can understand what is abnormal. So what is normal periods is like usually it is between from 21 to 35 days. No one has so it changes like from 21 days to 35 days. Some may have it 26 days, some may have it 32 days, and some others have 35 days. So basically, no one ever has like fixed 28 days cycle. So how to count the cycle is like from the first day of your period to the first day of your next period. That interval is called your the period cycle. Okay. So basically, when we call it is normal, is like there is a 5 to 7 days variation is also fine with your cycles. And also if there is a bleeding of 2 to 7 days, that is fine. And if you're not having clots or if the flow is normal everything, then we call it as normal period. So basically there is the period can be from 21 to 35 days cycle, or and you will have 2 to 7 days duration of the cycle. And you may have normal flow and no clots. Okay, this is called normal cycle. So coming to the normal cycle, what are the main hormones involved in this cycle are like four things which are very important, and you'll be might listening about this. That is like LH. First is follicle stimulating hormone. Second is luteinizing hormone, and other hormones are estrogen and progesterone. Basically, this FSH and LH are formed from the brain, from the hypothalamus. We secrete the GnRH. From there, we get FSH and LH, and whole cycle takes place with these hormones. So first, after 5 days of your menstruation, after there is a follicular phase where the follicles are formed, and during that phase, we have more of estrogen, which stimulates, give. Higher estrogen will go and stimulate, will give the brain a signal to produce LH. Whenever the more LH, we will have ovulation. So once the ovulation, the follicle, from the follicle, the egg will be released, and here this remaining corpus luteum secretes the progesterone. So that's the way how our menstruation works. And coming to that, so the first 14 days, like from the menstruation to the next other days, is always varies. Okay, so after the ovulation is, which is called luteal phase, is always a fixed 14-day cycle. So whatever changes, whatever stress, whatever things happening, because whatever irregular cycles you're feeling is all in the first phase of the or menstruation cycle. Okay, if you have any problem in ovulating, then the cycle will get irregular. And coming to the, so now we discussed what are normal periods. Like I said, 21 to 35 days, a variation of 5 to 7 days is normal. And if you are having 2 to 7 days normal flow, everything is normal. We are not having clots and everything. Naturally, natural menstruation does not have clots, pain, anything. Then what is irregular cycles? Irregular cycles are like that occurs less than 21 days or beyond 35 days, or if your if your cycle is associated like missing 3 or more periods in a row, or if you are recurring the same problem within 2 times to 3 times in a year, like whatever I said, and periods that last longer more than 7 days. Like I said, if it usually it is not associated with the clots, and the normal blood flow is like up to 50 ml. Usually we cannot measure the bleeding, but you can understand if the bleeding is associated with the clots, and if it is more heavy, and if it is associated with the pain, or that accompanied by severe pain, cramps and all, and if you are soaking more than one pad in an hour, and also important thing is if you are having bleeding in between the cycles, like spotting in between the cycles, or if you are having bleeding after the intercourse, or if you are having bleeding after the postmenopausal period, all these are abnormal things which are comes under the irregular cycles. So as I said, if you know the normal cycles only, you will know the irregular cycles. And if you find any things whatever I have said, then it's a time you are worried about, you have to take a call about the irregular cycles. So what are the causes of the irregular period? So when coming to the causes, the most common is physiological causes. So physiological causes is like natural causes. So many times in our life we feel irregular cycles. When I can say it's natural causes, number one, it's in pregnancy. In pregnancy, you know, you have amenorrhea, that is natural to have irregular cycles. Number two, in the lactation, when you are feeding exclusive breastfeeding, definitely you will have amenorrhea, that is like not having the periods, and that is also considered as normal. And other thing is like early teenage. So many of the girls who gets matured at early age, not like normally, don't get periods regularly like as we are having. So first 2 years, I always say like first 2 years for the teenage girl, once she gets a mature, it is not like they will get regular cycles, because our like I said, hypothalamus pituitary axis takes some time for the girl to adjust. So first 2 years having regular cycles in the early teenage is very common. Coming to that perimenopausal, in the sense like if you're about to get the menopause before, sometimes your cycles are getting irregular. These are all are like normal causes and natural causes which cause the irregular cycles. Coming to the other conditions, medical conditions which are causing the irregular period, that's what we are here. The first most common problem is thyroid problem. It might be hypothyroidism, it might be hyperthyroidism. Any other thyroid problem, hormonal problem is the first most common cause for us to affect our cycle. So whenever you have thyroid related issues, like other symptoms also of thyroid, like constipation, intolerance to the cold, and having heavy flow or less flow, whatever things, you have to check your thyroid hormones. Number two most common thing for the regular cycles is polycystic ovarian syndrome. You know, now it is the most common thing which is causing irregular cycles. So because of the abnormal hormones, here also the irregular cycles are very common. And the most other thing which we have to discuss relating to the hormones is prolactin. Prolactin is the hormone secreted from the pituitary, and this also get affected when there is problem in the any stress or any other related factors. Prolactin is also one of the factor for the irregular cycles. And other causes like premature ovarian failure. This is nowadays has been we are seeing in the our clinics. Actually, premature ovarian failure is very rare, but still nowadays we are seeing the cases. That's what I want to give some message to you. It is like if usually menopause we get at average Indian at 52, but nowadays we are saying because of the stress factors or any other genetic related things, the menopause, if it occurs early less than 40, we call it as premature ovarian failure. In those cases also we see the irregular cycles. Coming to the most common thing, I said all the hormones which I have said, like thyroid, polycystic ovarian, whatever the hormones has to be treated only through the hormones. You cannot treat with other things. Like if you have thyroid problems, you have to correct the thyroid only through the thyroid hormones, but you cannot treat with the other way. So definitely you have to know your thyroid levels and meet your endocrinologist and get treated. Coming to the polycystic ovarian disease, as you know, this is the most important topic, and this is completely we can talk whole day about polycystic ovarian disease. But coming to the shortcut, like polycystic ovarian disease, mainly because of the multifollicular thing, which is releasing androgen, which is a male hormone, which is causing all other problems. And in this, you can see the most common like irregular cycles. The irregular cycles may be like complete amenorrhea, like once in 2 months, 3 months, you may get period. Some people may get periods once in 15 days, once in 20 days, and sometimes they may have very less flow, and some may have heavy flow. And if it is associated with the irregular cycles, associated with the excessive weight gain, or male hirsutism, or any other acne or any other cosmetic related any other problems, you have to visit your gynecologist and find out whether you have PCOS or not. Next, other more medical complicated, as I said, gynec related causes for the irregular cycles is endometriosis. Endometriosis is something which, like the endometrial glands, which are present inside the uterus, if they are present, this tissue is present is in other parts of the uterus. Then we call it as endometriosis, and it may cause abnormal bleeding, cramps, irregular cycles, and all. So this is one of the cause. I'm not saying this will be the cause, but this is one of the cause which causes irregular cycles. Coming to the next, not very common, but one of the causes like PID, that is pelvic inflammatory disease. In this, because of the infections which travels through the uterus and the tubes and the ovaries, we get this irregular cycles, pain, infection, and vaginal discharge and all. So PID is one of the cause among for causing the irregular cycles. So if you have any small foul smelling discharge or irregular cycles or any pelvic pain because of untreated sexually transmitted infections, PID is usually seen. So you have to keep in mind that PID is also one of the cause for the irregular cycles. So these are some of the like gynec related issues which causes the irregular things. And as I told, like medical issues like thyroid, PCOS, prolactin excess, premature ovarian failure also you have to keep. So I another other factors which cause irregular cycles. The most common thing is lifestyle factors, which is like most increasing nowadays, and which we have to concentrate and which we can change ourselves. That is first most common is obesity. Because of excessive weight gain, the other hormones and others are also get disturbed. Here also hormonal imbalance is the main thing which causes the problems. So obesity, excessive weight gain, you have to please take a call. Second thing is physical and mental stress. When I say stress, it is not only the physical stress, there is also a mental stress. Coming to the physical stress, like you can say if you have any issues like chronic illness, or if you are suffering from fever for long duration, or if you have chicken pox, example, any other this medical conditions which is causing the physical stress, usually also has effect on the irregular cycles. Coming to the mental stress, like other factors, like if you have exams, or if you're traveling to the new place, or if you have any marriage or whatever, mental stress related issues also cause irregular cycles. And most important thing is sleep hygiene. If you're not at what time you are sleeping and how many hours you are sleeping is also very important, because it also has a very important role on our cycles. Because sleeping at 2 o'clock and getting up 10 o'clock, we think we are sleeping on the right time, but you know our circadian rhythm, which says like morning and evening things, our hormones get confused what to release at what time. If you're sleeping at 2 o'clock, our brain don't know what to release. So that's the thing, you have to sleep on the right time. Sleep hygiene is very important to control your irregular cycles. So other abnormal menstruation cycles, things like medications. So many of the psychiatric medications and chemotherapy medications or anticoagulants, all these have effect on our periods. So when you have irregular cycles, please know about what medications you're like having, and you have to mention to your doctor also what medications, because there are so many medications which affect our cycles. So next coming thing is how to tackle all these things is the main thing. So now we have spoken like lifestyle factors, second is medical condition like hormonal imbalance, and third one is gynec problems. So among these three which we can give some effort is definitely lifestyle factors. Okay, so whatever the symptoms if you have, please don't ignore them. First thing is you have to meet your gynecologist if you have any other symptoms, and if this irregular cycles you are feeling repeatedly, and if you're having this irregular cycles, as I mentioned, like 2 to 3 times, or if you're having whatever I said like previous, if you're having repeatedly, it's a time you have to meet your gynecologist. So when you meet your gynecologist, what she actually does, she takes your detailed history, what medications are you, what are your symptoms, how is your history related to you and your family history and all. And then we examine clinically like per speculum and per vaginal examination, because during the per speculum also we will get to know the cause for the irregular cycles like polyps and all. most of the reasons for the irregular, like spotting, intermenstrual and all, we can see through the cervix by seeing the speculum examination and vaginal examination. And your doctor may ask by examination, she may suspect any other structural causes to your uterus. She may ask for the blood investigations like hormonal, especially thyroid and all, based on your history, and other hormones like, as I mentioned, like FSH, LH, or estrogen, progesterone. Or she may ask for the scan. It might be transvaginal skull, or to know the structural causes of the uterus which are causing the problem for the irregular cycles. And the most other common problem, like when they mention about when we see the scan and we see any abnormality in the lining, or especially in the postmenopausal bleeding and all, we ask for the hysteroscopy. And hysteroscopy is something which we can go through from the uterus, from the down through the cervix, and we can see the lining of the uterus, that is endometrium, and see the polyps directly and take a biopsy. These are the basic investigation which we do routinely for the normal things, like a scan, clinical examination, and a blood test. So after that, so when it comes to the treatment, definitely I always want to mention about the lifestyle modification. I said, right, among the three things which we categorize today, like medical problems, like hormonal, gynec problems, and third one is lifestyle problems. So which we can correct is most important is lifestyle modification. So I want to concentrate on this to tell about this. It's definitely healthy diet is very important in the, like I said, how the sleep hygiene is important, the what type of food is you are taking, and what time you are eating, and how you are cooking, all these are very important. And always, like I mentioned, diet is an important part of our lifestyle. So definitely, to if you are confused about your diet, definitely you have to take a dietitian advice regarding the diet, because diet always helps to reduce the overweight issues or thyroid issues or whatever issues. So definitely healthy diet is very important. And as I mentioned, avoid junk food. Always natural food and healthy food is important. So no maida and no junk food. And avoid plastic, because plastic nowadays we see some component called as xenoestrogen, which is most which mimics estrogen, and it will after entering into the body, it actually mimics the estrogen, and it will have effects of the drastic excessive estrogen effects. So always try to avoid the plastic. And come not but the least, but physical activity is compulsory, though you don't join the fancy gyms or pilates, whatever, but regular yoga or regular walk is just enough, just for 15 to 20 minutes. Regular physical activity is compulsory for everyone. So I always mention this, though you don't do anything, just go for a walk for 10 to 15 minutes, which will alter all your stress and other things. And least but not the least, that the important thing is meditation or whatever self care practice is very important to de-stress yourself. So stress is one of the biggest factor which is causing all these problems. So I know getting de-stress is not easy, but you have to choose what it is better for you. Other treatment medical options are like, as I said, thyroid hormonal problems have to treat by the hormones only. There is no, other than that you cannot treat in other way. So if you have thyroid issues, please get treated with the thyroid. If you have PCOS, you have to have a detailed plan how to get treated. PCOS is also not something like you take a medication so that you get set within 1 month, 2 cycles, 3 cycles. It is an effort of your healthy food, physical activity, and your hormone imbalance. All these things put together only you can control your PCOS. And other things like I mentioned, like if you have any issues like with the excessive bleeding and all, treating anemia, and also like I said, like infections, we have to treat the infections also accordingly. So other what we do is like, when you have see, anyway we will be bleeding naturally every month, so iron rich diet and other supplements are very important. And iron rich supplements of food, like whatever you're taking in the your diet is very important rather than the taking tablets. So coming to the medical management, how we treat the irregular cycles, definitely we will go after going through the history and finding the problem. Accordingly, we will treat. But generally, like when we say how we treat the irregular cycles, either it is heavy cycles or irregular like that. If the cause is known, it's always to treat through the cause. Other general management is like we give NSAIDs, which are the painkillers for the heavy flow and other, and oral contraceptive pills to regularize your flow, which is most common, and it might be progesterone related intrauterine device is more common, especially after your parity and all we will see. And Marina is one of the most important, and it's like revolutionary thing, which I personally like the Marina benefits. So if you have any regular cycles, any structural related problems or on, we can try with the Marina. And last, if everything like medical management or sometimes really there are structural things which has to be treated with the surgical management or something like fibroids and all. For those things, if you see any problem if for the medical management does not help, then we have to go for the surgical management. Definitely that is like removal of the fibroids, like polyps, like I said in the hysteroscopy, like inside the lining of the uterus, if you have any small growths like mucosal growths, like they are called as polyps. If we see those things, no, definitely we want to remove that. They are called as removal of the polyps and polypectomy. And finally, but not least, like hysterectomy in very rare cases, which everything, all sort of treatments are not sorted, then we have to go for the hysterectomy. Okay, so coming to the take home message, how can we lower the risk of all these irregular cycles, and how to reduce this irregular thing? Definitely, as I told, lifestyle modification, maintain a healthy diet, healthy food, and healthy sleep hygiene is very important. And make sure you get enough rest, and de-stressing is also very important. And I want to mention about this, doing excessive exercise is also not good. Always moderate is always important. Moderate exercise, using all this, and using birth control pills under guidance is also very important. Nowadays randomly everyone are using those pills. Please, under the guidance of your gynecologist, please take the medications, and see your gynecologist anytime if you have any other problems. Is the most primary healthcare thing which you can do yourself. Thank you so much. If you have any doubts, please can put in this box. Okay, there are. Okay, I think there are no questions. Thank you everyone.